Hi, Monty Jett here, and I have a very special guest I want to introduce to you, and our guest is going to tell you about an incredible thing. Dr. Bradley Morris is with me today. Dr. Morris, tell me about Rejuvenate Health, and what are your goals there? What's your mission there?
Well, our mission is really to find out exactly what is causing everyone's problems. What is the source of the pain? We want to get rid of the pain, but we also want to find out what is causing the pain so we can make the pain go away and stay away. And it doesn't necessarily have to be pain. It could be any other symptom associated with the body.
Now, when you say you're going to make the pain go away, how do you do that?
Well, there's a multitude of ways that we do it. I'm a chiropractor by trade, so we do definitely do spinal adjusting. Dr. Dekel is a surgeon, so he works with bioidentical hormones. We do laser therapy, we do decompression, PMF, and probably the thing that we love the most is regenerative medicine.
Well, when you say regenerative medicine, that sounds like stem cell, and I'm regenerating something in my body.
Well, you're absolutely right. With regenerative medicine, stem cells are included in that, but there's other therapies that are regenerative as well. Prolozone therapy, biophotonic therapy, those are all regenerative types of therapies.
Let's focus today on stem cell because I have a lot of interest in that, and a lot of people are interested in how does it work, and where do you get it from?
Well, we use stem cells from an umbilical cord, and we get these after planned C-section, and that C-section delivers a healthy baby. Umbilical cord is obtained, and then it is tested to make sure it's going to be safe for when it gets to our clinic, and we're able to administer it to the patient.
What patient would be appropriate for a stem cell?
Well, that's a really big question. So probably the most prominent people that are being associated with the stem cells are going to be the people that have joint problems. But stem cells are able to become anything. They're immune system privileged, so they haven't become anything before they go into your body. So they can actually help regenerate bones, ligaments, nerves, muscles,
Really?
and even organs.
First, you have to come in and decide what the problem is, what caused the problem, before you can do the stem cell.
Absolutely. It's in regenerative medicine, it's a little bit bigger than just getting, having a pain and then just getting a stem cell injection. And that's really the focus of our clinic is we want to find out exactly what is causing the problem. So if stem cells is a good option and that's all it needs, great. But if there's something else that has caused that joint to degenerate, for instance, yes, the stem cells will go in there and repair the joint. But if we don't find out exactly what caused that joint to fail, then it's probably going to fail again.
Well, what would be some of the things that would cause a joint to fail that just regenerating the joint won't fix?
Well, of course, one is trauma. And those are the ones that are the easiest to spot. So people know when they get hurt from trauma. But the ones that are more hard are the people that have biomechanical issues. They have some systemic issues. They have inflammation going on in their body. But they're only really having knee pain. And so they think it's just the knee that is the problem. And then when they come into the office, we actually have to examine them and find out, okay, is it just the joint? Is it a nerve? Is it a muscle? Is it systemic? Is it an inflammatory response that's causing this knee pain? And if you don't identify these things, the stem cells can be unsuccessful. So once the stem cells are injected into the joint per se, the stem cells are actually going to work immediately. And the way it works is this: there's an enzyme that's released from this inflammation in that joint. And it's the stem cells are looking for that enzyme. When they see that, they're going to attach to it, and then they're going to replicate and differentiate. So what that means is they're going to keep dividing into more cells, and they're going to differentiate into that cell type. So it can differentiate into a bone cell, a nerve cell, a ligament cell, a muscle cell, or even an organ cell.
How long does that process take before I feel better? Is it going to take a couple of years, and all of a sudden I have a new joint?
Well, a couple of years would be a long time to wait. So no. And that's one of the goals is we really want to get you out of pain as quick as we possibly can. And I think that identifying the source and cause of that is key to getting rid of that pain. So in our clinic, we're getting people out of pain quite quickly and really in just a couple of weeks.
Wow.
Now, that doesn't mean that they're going to be pain-free forever because most of the time when people start to feel better, they do more. And they've been babying this thing for no telling how long. So that's why we have people come back into the clinic so that we can keep up with them, give them some therapies that are going to help get rid of the pain even faster, and as they start including more exercise and more stretching.
In this area, probably shoulder replacement, hip replacement, knee replacement is number one on the hit parade. Would you suggest that that instead of surgeries, this could possibly be an alternative?
It by far is the best alternative to surgery. Unfortunately, sometimes people don't have another choice. But before getting a surgery, before getting a surgery, looking into stem cells is probably the smartest thing anybody can do. And here's why. The success rate for shoulder surgery is just not very good. And then when we get to the hip, it improves a little, but not much. And then when we get to the knee, it's probably the best. And what I mean by the best, I'm talking about the best out of the three. And the latest research shows that best is 33, 33, 33. And what I mean is 33% do good, 33% do okay, and 33% don't do good at all. They fail.
Well, the news is filled with problems with those surgeries, with problems with cobalt, problems with the mechanics of what they put in your body.
Absolutely. And the side effects associated with those different metals is vast. We don't even know all the different things that it causes our body to do and react.
I hate to ask you this question, but how does the insurance company view stem cell research versus surgery?
I'm not sure how they review the research, but I know they don't want to pay for the stem cells. And there's a number of reasons why. The stem cells are not a drug, so they're not covered by insurance, and the pharmaceutical companies aren't selling them. So that's one reason. The other reason is they're coming from umbilical cords. How are these pharmaceutical companies going to collect umbilical cords? So that's the reason I think that an insurance company has it. And I really believe that if an insurance company does start doing it, the cost will just far exceed anything that we can imagine.
How affordable is this?
Well, the great news is in the last
what price do you put on your own health too, I guess?
Absolutely. The price really depends on how bad the joint is and where it's being injected. So a larger joint is going to require more stem cells than a smaller joint. Systemic issues, neurodegenerative issues are going to require many more stem cells than a knee per se.
Well, we could talk forever, and I hope we will continue this conversation, Dr. Morris. And you'll come back often, and we can continue. Rejuvenate Health is located right before the bridges, just past the Bridge Center, and that building just before the bridges. But you probably should call and make an appointment. Or go online? Which is best?
Calling our office is the best way. The phone number is 843-757-STEM, and STEM stands for 7836. So 843-757-7836.
Well, if you have questions, you want to learn more about this, you can certainly visit them online or just call and make an appointment. But certainly before you even think about surgery, let's check these alternatives out. And I know you'll thank me, and I look forward to continuing our conversation.
I do too.